main findings from my review were there were 25 studies that included HFpEF in some way, either exclusively or as part of a mixed heart failure sample. HFpEF exclusively, there was only 10 studies. All of the interventions were typically highly tailored and quite difficult to replicate based on the reporting. Comparison groups were very variable, and often they were comparing a dietary intervention to a standardized diet or a dietary intervention to usual care. And the outcomes were multiple, very heterogeneous, and would be difficult to combine in a meta-analysis. I think the most important points of the review were highlighted that studies are still not separately reporting the heart failure phenotypes, and it would be helpful if they started doing so. This would enable better meta-analysis. The rationales for undertaking a dietary intervention were not always clear. Well, while studies did give their grounded their backgrounds in the literature, it didn't appear that they were utilizing patient groups to determine whether this was important to them, something they could actually achieve and would be interested in joining in with. And lots of the outcomes didn't seem to link up to the biological pathways that the interventions claim to be manipulating. Or samples were not specific enough. For example, the SALT studies did not isolate patients who had elevated levels of salt intake. They used a generic sample of patients coming through clinic doors. So there was no determining whether they were salt sensitive, whether they already consumed too much salt or too little salt. So the overall messages were that it would be great if we could standardize outcome measures so that we can combine studies. Dietary interventions are very expensive and difficult to implement. So if we have some more standardized measures, then we can improve our ability to do meta-analysis or reuse the data in other way. It would be great if we also reported heart failure phenotypes more clearly and maybe even separately analyzed the different groups